So today I'm going to talk to you a little bit more about posture. Now, growing up as a kid, I'm sure somebody in your life has always told you to stand up straight, sit up tall, all those different things. And that actually is very good advice, because as we get older, we tend to lose that ability to remember those things. What causes bad posture? So the biggest thing currently with all the technology that we have these days is the prolonged sitting. And you can be prolonged sitting in many different areas. So the first thing is at school, we're seeing more and more kids actually in the clinic with back pain, and that's because of their posture at school. So a lot of classes are longer. They do block scheduling in a lot of the high schools, so you're sitting in class for an hour and a half at a time. And the more you get tired, the more forward and slouchy you start getting. That then starts the whole process with poor posture. As you get tired, your chest muscles get tight, and the muscles in the back of your scapula area and shoulder blades and the back of the shoulders kind of get stretched out and overstretched, and you start getting that hunched over or forward position. The other thing is a desk job. This day and age, there's so many tech IT jobs, and more people are sitting in front of a computer all the time, and sitting and not taking breaks. So the more you sit, like I just said, you're focusing on a computer, your body gets tired, and it just continues to hunch over and slouch. So again, those chest muscles start to get very tight, your shoulders actually start to come rolling forward, and then your shoulder blade muscles actually get overstretched, and then they become weak. If you drive a lot for work, whether it's just commuting distances, which is huge in this area, or truck driving or anything like that where you have to drive long distances, that becomes a huge component of posture, because you're sitting for a long period of time again, and over time you get tired and you're holding a steering wheel. And so it becomes important to recognize things that we can do and alter. What else causes bad posture? Now, I said bad posture can cause pain, but it can also be the other way around. You can have an underlying already back pain or neck pain, mid-back area pain that's coming from something completely different, and because of that pain you start to change the way your body is. So sometimes when people have back pain, they tend to lean forward because that makes them feel better, but that puts you in a bad posture. So in a sense, you're trying to relieve your back pain, but at the same time you're causing all these other abnormalities and altercations with your muscles. Also, when you have back pain in the upper part, in the mid-back, or even in the neck region, your neck starts to come forward a lot, so you're losing the ability to keep your head back and your shoulders back. So the other issue with posture becomes poor body mechanics over time. So whether you have a job that involves a lot of lifting, or also a lot of repeated movements, where you're bending over a lot, anything like that, you're going to have to be more aware of your posture, because when you lift, if you're not lifting correctly, and you have bad posture, which is bad body mechanics, you're going to then struggle with more instances of back pain, neck pain, shoulder pain. The other thing is just general weakness of the core. If you do not have a strong core, and by core is your abdominals, your hips, your pelvis, all those muscles that stabilize you around here, if they are weak, they are not going to help support your back muscles. So your back muscles are going to be overworked. And because of that imbalance, that's going to affect your posture. You're not going to be able to stand up tall, because when you stand up tall, you're actually supposed to engage your core. You're supposed to tighten those muscles around the mid area into your buttock so that you do have good posture. And when they're weak and tired, again, the common theme here is that you lean forward, your shoulders are forward, everything's tight, becomes tight in the front, and weak and overstretched in the back. Scoliosis and osteoporosis. Scoliosis, usually when it starts when you're younger, is pretty mild, but over time, just from a mild curvature of the spine, which is scoliosis, we've seen high schoolers come into the clinic with back pain. Even the slightest curvature in that back, what it's doing is part of the curve, it's tightening muscles, the other part is overstretching. So because of that, there then becomes that tired factor again. So when they're in school, they're slouching over to one side versus the other, so they're accentuating that curvature in a sense. So it's important to address those structures that are tight and also those structures that are weak. With osteoporosis, as we know, it's very much more common in the female population around menopause. There is abnormal breakdown of the bone and it becomes brittle. So as that happens, there are instances where things such as compression fractures can happen, and just generalized back pain because of the issues going on with the bone. And as people are well aware, if they've seen anybody that is pretty hunched over like this, and when we're talking severely hunched over, usually that is some sort of osteoporosis going on in the spine. The symptoms, what I wanted to go over were some symptoms. Fatigue is the biggest thing. If you just notice that you're constantly getting tired, you need to get up out of the chair. You can't just sit there for hours. You need to give your body a break to get into the other position. So if you're spending all your time at a flex position like this, you need to do the extended position because your body is made to do both. So if you're doing too much of one, you need to counteract by doing the other as well. Pain is a symptom as well. Just usually it's not an immediate sort of symptom, but over time, if you continually have bad posture, you're going to shift the mechanics of some of your joints because of the tightness on one side and the weakness on the other. So because of that, for instance, your shoulder will become affected because that socket is all the way back here, and then your humerus, which is the ball, is all the way in the front. And because of that, you can get other injuries, overuse injuries that involve tendonitis in the front of the shoulder. So we want to try to work on doing good postural exercises because then we're opening up that chest area and then also strengthening it back here so that there's good alignment and good joint mechanics. The other thing is some breathing issues. That's more with people with the severe osteoporosis over time because they become so bent over like this and so closed in the chest. When they breathe, there are muscles that surround your abdominal area that are assisting you for breathing, and when they're that tight, you take a breath, they cannot expand and relax like they should. So when you try to take a deep breath, they can't take a deep breath, so they're not getting that air into the lungs that they need to do. Tightness that you notice maybe on the front of your body versus being really nice, overly stretched in the back of the body, tightness in one side of the spine versus, really loose on the other side, which would be scoliosis. So what can PT do to help these problems? A lot. So pretty much you want to do certain stretching exercises to open up the chest area, the pecs here. Strengthening exercises, so whatever you stretch here, you want to strengthen in the back. So all your scapular shoulder blade muscles in the back, your rotator cuff muscles, which are the back of the shoulder, to keep that joint in the socket correctly in the shoulder area. You want to strengthen the core, which is all this area here, and that's going to give a really good support system for your back. So then you're less likely to have pain when you have a nice core strength system here that takes the brunt away from your back muscles, so that will alleviate that pain. Energy conservation techniques, believe it or not, PTs are able to teach people good breathing techniques and help them, along with all that stretching in the front, on how to take a good deep breath and increase breathing endurance. Proper body mechanics instruction, we do this all the time, and it doesn't even necessarily mean that you have to have a job where you're lifting a lot. We teach people all the time who just do normal everyday activities, lifting laundry or lifting something overhead or carrying your grandchild or your baby or anything like that. If you're not carrying them correctly, that's going to lead to abnormal postures and pains. Also, manual treatment. If you have muscle spasms in the spine, which is pretty common with scoliosis, we can work on those. We can do soft tissue techniques to those. Trigger points where there's a knot in a muscle that radiates pain somewhere else, we can work on those as well to try to help you with that. Ergonomics is huge. We can help assist in giving you ideas about correct chair alignment with your computer, your desk, making sure everything is set the way it needs to be so that you have good back support and that you're in a more upright position. And also, home exercise programs are crucial because, like coming into the therapy office 2 to 3 times a week is definitely not enough, and once you're discharged, you're going to have to do it on your own anyway. So giving you a good home exercise program where we can build up the exercises and make you more aware of the different things that you need to do on your own. If you're interested in learning more about posture or have any further questions, you can give us a call or click on the link below, which will give you our phone number, and you can schedule an evaluation with us.